Hi, I'm Dr. Sandy Boshears from Heskett Family Chiropractic. Today, I would like to talk to you about plantar fasciitis. Have you or anybody you've known had plantar fasciitis? Well, I can tell you it can be very painful. So, what is the plantar fascia and how does it get irritated or inflamed? So, the plantar fascia is tissue that's running from your heel, your calcaneus, all the way up to your toes. And so sometimes things like not having the best support in your shoes, just being on your feet all day, repetitive stress can cause inflammation and soreness, and sometimes even little micro tears and traumas that's in the bottom of the foot. So what can we do to help with that kind of pain and when you have that going on? Number one, I would like you to get adjusted. As your hips are lined up and not misaligned, it's going to help to balance the pressure on your hips, your knees, and your feet. So a few things that you can do. Number one is have the best supportive shoes on through the majority of the day so that you're getting a good support to your arch and to those muscles so they're not fatiguing. Another thing that you can do is really stretch all the muscles that are in your foot and in your leg. So here's a photo of the back of your leg, your calf muscles. And so in your calf muscles, you have the gastrocnemius and the soleus. You can see as the muscle comes down, it becomes the Achilles tendon. In this next photo here, you can see this young lady with her hands up against the wall and she has one leg back. What she's doing is she puts that leg back is she's putting her heel down to the floor and therefore getting a really good Achilles stretch. That Achilles stretch will help in decreasing the tightness on the muscle and give you less pain in that as well. Another one, as you're doing this stretch, is not only is the heel back to stretch the Achilles tendon, but after she holds this pose for 10 to 20 seconds, she's going to slightly bend her knee and that stretches the other muscle, the soleus muscle. In this next photo here, you can see somebody is just taking their toes and bringing them back, and that too is going to help stretch the plantar fascia. So what do we do to stretch some of these things when we're at home? Another one that you can do is use a little ball that looks like this. This is called a therapy ball. This therapy ball, you can see in the photo here, the person is just taking it and moving it back and forth and putting as much pressure as they feel comfortable on the bottom of their foot to really stretch and to relieve that muscle tension. Another really good one, after you've done some of those stretches and used your TheraBall, you can get a water bottle, fill it with water, freeze that, and then use that on the bottom of your foot. Same thing like the therapy ball. You can move it back and forth for a little therapy or put it on the really sore spot and ice 15 to 20 minutes to reduce inflammation. Please let us know at any time if you're experiencing plantar fasciitis. We will adjust your spine, but we can also check your foot. Any of the bones that are in the foot can be adjusted, your calcaneus, your talus, metatarsals, your cuboid. We want to make sure that you have the best mobility, alignment, and proper function in your foot to relieve some of that stress. We love you. We appreciate you. We're so thankful to be serving you. Have a wonderful and blessed day. Bye-bye.